Good morning, everyone. Welcome to today's webinar on access to countermeasures. This is the fifth and last webinar that we will have in this series to prepare the subregion for updating their national pandemic preparedness and response plans. I am pleased to open this session, and I really thank all of you for joining and being committed over the last 5 weeks for us to engage in these discussions. Our focus today on access to countermeasures is not just timely, but I think it is very essential. A lot of the Caribbean countries are still reflecting on the lessons that we would have learned during the COVID-19 pandemic and other emerging health threats that we have experienced. And access to medical countermeasures, whether it's looking at vaccines, diagnostics, therapeutics, PPE, it remains a serious issue, a critical gap in our ability to act swiftly and also provide equitable access in future public health emergencies. So today we are honored to have with us an expert panel of presenters who bring, I think, deep knowledge and practical insights to this discussion. So firstly, we have Ms. Shoshana Golden, the focal point for seasonal influenza at the WHO, Francesco, fondly known as Chesco, Nogareda from our PAHO regional. He's our PAHO regional focal point for influenza vaccination. Ioana Gika, our focal point for pandemic influenza vaccination from WHO. Murilo Freitas and Jose Luis Castor from the PAHO Access and Innovation in Medicines and Health Technologies Department. Each of them will guide us through these key areas, whether it's from planning, access pathways and regulatory frameworks to deployment strategies and lessons from past responses. We know that many of the countries in our region grapple with challenges around equitable access, regulatory readiness, and supply chain reliability. So today's session really is meant to help close the gaps with practical tools and some insights on tested approaches. So I encourage everyone to engage actively. Our advisors are here not only to share, but to respond. So please don't hesitate to ask questions that you really would like answers to during that Q&A session. So with that, let's get started. Thank you again for being here, and I'm going to hand over to Shoshana.
Wonderful. Thank you so much, and very happy to be here to present to you all today. I'll be talking a little bit about PrEP, with a specific focus, of course, on access to medical countermeasures. Next slide, please. And as we do that, I think it's really helpful always to ground ourselves in the global influenza strategy, which is our guiding resource on all aspects of influenza. There's a very strong focus on seasonal influenza prevention and control in the strategy, with the understanding that seasonal prevention and control actually helps to prepare countries for pandemics. So if you tap once more, next slide, just tap. Perfect. What we can see is that through a combination of the global influenza strategy and the pandemic influenza preparedness framework's partnership contributions, WHO is actively working with countries around the world to strengthen their national capacities. Next slide, please. And one of the best ways that we've seen to strengthen national capacities to prepare for future pandemics is actually by investing in a seasonal influenza vaccination program. What we saw both in 2009 and in the COVID-19 pandemic is that countries that had a seasonal influenza vaccination program in place before the pandemic began were better able to distribute the pandemic vaccines once those became available. They reached higher coverage rates, they had faster deployment efforts, and they typically had fewer regulatory bottlenecks. So instead of hearing a lot about this from me, if we tap over to the next slide, we actually have a very fresh off the press video that briefly talks about how seasonal influenza vaccination supports countries in preparing for pandemics.
The next pandemic is inevitable. While we don't know what disease or when, countries need to prepare. Strong vaccination programs are one way that countries can prepare to protect their populations. We've learned from the 2009 influenza and 2020 COVID-19 pandemics that having a strong seasonal influenza vaccination program prepares countries to respond. Countries with an existing seasonal influenza vaccination program achieved faster and more efficient pandemic vaccine introduction and reached higher coverage levels during past pandemics. WHO recommends that all countries should consider implementing seasonal influenza immunization to protect their population from annual epidemics and enable pandemic preparedness. Annual influenza vaccination programs make sure that countries have the experience and resources they need to quickly vaccinate during a pandemic. This includes experience developing national policies for adult vaccination, capacities for data and monitoring, trained staff, adaptable communications and other campaign materials, and experience reaching adult populations. Annual influenza vaccination keeps priority groups like health workers, pregnant women, older adults, and people with chronic conditions from becoming severely ill, thereby keeping people out of hospital. Annual influenza vaccination also reduces the number of seasonal influenza-related deaths, particularly among older adults and people with chronic conditions. Annual influenza vaccination programs help countries save money by reducing the number of hospitalizations and health workers' sick days. Seasonal influenza vaccines can be co-administered with other vaccines, such as the COVID-19 vaccine, during health visits. Procurement of seasonal influenza vaccines each year supports pandemic preparedness by maintaining global production capacity. This can increase the global supply of pandemic vaccines. WHO has resources to support countries in developing or expanding their influenza vaccination programs. To learn more, visit the WHO Seasonal Influenza Vaccination Toolkit. We all have a role to play in preparing for the next pandemic. What can you do?
Wonderful, thanks. Can you tap to the next slide, please? And we know that the PAHO region actually is a global leader at using seasonal influenza vaccination programs to prepare for and respond to pandemics. So just want to take a moment to appreciate all the work that's been done in the region of the Americas to ensure that vaccines are accessible to countries and are being used each year. The video briefly talked about production capacity, and I thought it would be helpful to dive into a little bit about why this is interesting and relevant for countries as they're thinking about pandemic planning. We know that having seasonal influenza vaccine production capacity maintains manufacturers' ability to supply pandemic vaccines. Every few years, WHO actually conducts a process of surveying each of the influenza vaccine manufacturers around the world to estimate the global supply of seasonal and the potential supply of pandemic vaccines that could be produced when needed. We recently completed this assessment process and actually have found that global production has remained stable over the last several years, but we still see a strong reliance on traditional technologies like embryonic eggs. We're envisioning that in future years, there will be new technologies such as mRNA and viral vector platforms that might actually speed up the supply of influenza vaccines. During her presentation, Ioana will talk about national deployment and vaccination planning. One of the reasons that we think it's so important to be doing a lot of the work that PAHO is doing right now with you is because as production speeds become tighter, it might actually be the case for future pandemics that influenza vaccines are accessible faster than they were previously, which means that we should be thinking about not just the supply of the vaccines, but our ability to access them and know what to do with them in advance. Production of influenza vaccines, both seasonal and zoonotic pre-pandemic, are occurring in multiple regions of the world, and they are actually occurring in the region of the Americas. So I know that you've got several of manufacturers using both traditional technologies, egg and cell-based, and of course, some mRNA vaccine platforms that can come online shortly. Our global production capacity assessment does not currently include mRNA vaccines because they have not yet been licensed for seasonal or pandemic influenza, but we do anticipate that they will be in the next 1 to 2 years, and they will be included in future production capacity estimates. I know this session spends a lot more time looking at vaccines, but I also wanted to briefly flag to you the importance of antivirals as a resource that we should be thinking about for seasonal and for pandemic influenza. WHO does have guidelines that were newly produced by a fantastic clinical care team talking about what antivirals are recommended for influenza for a variety of different types of scenarios. We are also looking at the global supply of antivirals to support countries in understanding that landscape for pandemic planning. Next slide, please. The video also very briefly mentioned a toolkit, and I wanted to spend just another minute highlighting some of the resources that you can find on that toolkit to support you in your journey of seasonal and pandemic influenza vaccination program development. We provide a variety of different types of guidance documents, which include manuals on specific facets that might be helpful to deep dive into, including strengthening national policies and increasing access of vaccines to particular target populations. We also have a training package that is accessible that looks at both seasonal and some components of preparedness planning. We have a number of tools, and when I say we, it's really a royal we, because PAHO has actually been the one spearheading a lot of these tool developments to support countries in estimating both how many vaccines might be needed for target populations, which is really critical, not just for micro-planning for your seasonal campaign, but also is the information that you'll need for your pandemic planning as well. You need to make sure that you know how many people are in those target populations and actually where they are so that you're able to plan for distribution accordingly. And we found that some of the other tools about the cost of vaccination are very helpful to get buy-in from the ministries of health, in addition to the ministries of finance for successful and sustainable programs. The last thing I want to flag here is that there are a whole range of communications materials available and case studies from other countries. Next slide, please. Briefly, wanting to explain the difference between seasonal influenza vaccination policies and then the pandemic piece, because we see that seasonal influenza vaccination programs contribute to pandemic preparedness, but having one of these documents is not sufficient. Your seasonal influenza vaccination policy, which PAHO region has done phenomenal strides in supporting nearly all countries to have a seasonal influenza vaccination policy in place. That document really guides you through how you're using these vaccines each year for your annual campaign, looking at your target populations, your goals, how much resources you actually need, how you'll monitor your program and maintain progress, and who's responsible for doing what. On the other side, we've got our pandemic planning piece, which is really what the focus of these webinars have been about. Within those, I know you've talked a lot about your national pandemic plan holistically as part of PREP, and you'll hear from Ioana later today about a specific component on national deployment and vaccination planning. So to emphasize here that these are different puzzle pieces that come together to support you in this process. Next slide, please. And specifically within that pandemic plan, inside of PREP Module 1, there is Chapter 10, which is a deep dive into what countries are suggested to include inside of their national pandemic plan. Of course, it's a template, it's flexible. Please feel free to revise as you'd like. But we do strongly encourage you to look at these following considerations. And these are very similar, I think, to what Ioana will speak to much more in depth about in the National Deployment and Vaccination Plan. I just wanted to flag to you that there are these questions that are inside of PREP Module 1, and they're really helpful for you to be thinking about during your national workshops as you consider all the right stakeholders who should be at that workshop. First and foremost, are they the people who can answer these questions? And secondly, taking that time when you have people together to try and get on paper some of the answers to these really important facets of national pandemic planning so that you do have access to medical countermeasures during a pandemic. Next slide. With that, I'll turn over to Chesko to guide us, or back to Ornella to guide us through the next presentation.
Thank you so much for that, Shoshana. Yes, as you rightly said, we're going to hand over to Chesco to take us through pandemic vaccination, so the objectives and the challenges that countries usually see in implementation. Chesco?
Thank you. Thank you very much. So my session will be focusing on the pandemic vaccination, the main objectives and challenges. Since we don't know the type of virus we will have, likely influenza virus, but we don't know which type and subtype. We are talking about in a more generic way. Next slide. So as just a reminder, pandemics happen when a new virus, could be influenza, could be a different type of virus, emerges with the capacity to spread from person to person in an efficient and sustained way. And a pandemic disease is considered when there are cases spreading through several countries and continents around the world. So next slide, please. As Shoshana mentioned, the importance of having a influenza vaccination program is critical for pandemic preparedness. While we're waiting for a new vaccine for a new pandemic, we have two big main type of interventions. We have the non-pharmaceutical, the public health and social measures based on hygienic measures like isolation, quarantine, and the objective is to prevent the transmission of disease. And then we have the pharmaceutical or medical countermeasures. This is basically the use of antivirals for treatment and also specific vaccines against this pandemic virus for preventing the disease and reducing as well the transmission in the community. So next slide. We will focusing on vaccination. So the main three objectives of a pandemic vaccination when we have a pandemic is first, to reduce the risk of severe disease and death associated with this pandemic virus. Also reduce the transmission in community, and as well protect the integrity of the health system and essential services. So these are the main public health goals or objectives that the vaccines are targeting a population to achieve these three objectives. Next, please. So based on these three objectives, we define several priority groups. So for the first objective is to reduce the risk of severe disease and death. We will targeting or vaccinating people who are at high risk of developing severe disease or death. And this is mainly elderly population, individuals with chronic diseases, pregnant women, children, immunocompromised people. These are examples, since we don't know exactly what's the new virus, but these are a priori. They are these priority groups that should be considered. For the objectives of reducing disease transmission in the community, we will targeting children. They are not at risk of severe disease, but they play an important role in transmitting the disease in the community. We also vaccinating workers. They are working in living conditions. We're working in conditions that distance is not ensured, and also we will use the vaccine for outbreaks. And also, if we want to protect the health system and essential services as our objective, we will focusing and we're targeting for vaccination healthcare workers and other essential workers, police, teachers, community service. And all these priorities should be defined by the country itself in its national plan for vaccination against pandemic disease. Next slide, please. So we have the objective, we have the target population, and then we have to define the best strategies to reach this population. There are different strategies. As you know, for COVID, different strategies have been used, like using the health system, drive-through strategies, using community, also mobile teams. There are also the strategy of appointments, calling for reminders, and also visiting home. Uh, the vaccination should be also integrated in the health services, and also the mass vaccination campaigns and vaccination points that have been used for COVID-19. So several strategies for targeting different priority groups to achieve some objectives. Next slide, please. So what are the main challenges when we have a new vaccine for a pandemic new vaccine? There are, regulatory pathways for authorization on new vaccines, so the country should be prepared, and our colleagues, we will talk about this specifically later. Then we have the identification of the priority groups for vaccination and define the best strategies. We don't know who will be more at risk for the new vaccine, for the new pandemic, for the new pandemic virus, but we can define these priority groups beforehand as a preparedness plan for being prepared for targeting these populations. It's also challenging to ensure equitable access to population. We have limited access as well of vaccine, limited availability of the vaccine, so the vaccination probably will be conducted by phases based on the objective. So the primary objective is to reduce the risk of severe disease. We will target people first at risk for severe disease, and then consequently we can target other groups based on the availability of the vaccine. Another challenge is the management of different type of vaccines. We know the experience from COVID. There were vaccines they required specific temperature requirements, 2 to 8. Other vaccines -20 degrees. One is one dose. Another vaccine is 2 doses, 3 weeks apart. Another one is 4 weeks apart. So different vaccines, different types of administration, different types of storage and management. So that also creates a complex landscape for managing the vaccination. And then there are also challenges with the capacity for massive vaccination. We have to vaccinate lots of people in the country, so we need to have a strong cold chain system, waste management, and information system to track the vaccination. And finally, this is also important to conduct active post-marketing surveillance after vaccination to monitor the introduction of this new vaccine. This is overall. Next, please. But more specifically for the Caribbean, we have a specific context that some countries in the Caribbean islands, they have limited health infrastructure, especially in rural or remote areas. So that also makes a challenge for vaccinating these areas. There is also high vaccine hesitancy, at least for other vaccines, due to misinformation, religious or cultural beliefs. That also could be an issue for vaccinating with the new vaccine. Also, logistic and supply chain issues because of geographical isolation of some areas. We have the shortage in human resources and sometimes inadequate training of health workers. There is also weak health information system that to track the vaccination, to really understand the number of doses administered by group, by area, to really understand the coverage and to really implement corrective actions is needed for increase the vaccine uptake. And also budget limitations, financial limitations, and dependence in external funding. And finally, we also have the context in the Caribbean of natural disasters, flooding, hurricanes, and climate vulnerabilities that makes even more complex the deployment and vaccination in the Caribbean. Next, please. So as Shoshana mentioned before, the seasonal influenza vaccination program contributes to better pandemic preparedness and response. Has been demonstrated that countries that have strong seasonal influenza program responded better to the COVID-19 pandemic. Having capabilities for seasonal influenza diagnosis, treatment, and vaccination, surveillance, regulation, and coordination overall improves pandemic response. And countries with influenza vaccination programs had a faster response in COVID-19 pandemics. And there are some studies conducted to really highlight this advantage of the seasonal influenza vaccination programs for pandemic preparedness and response. Next. So as a final slide, the main messages or take-home messages, conclusions, pandemics are unexpected events, but not unlikely. So pandemic is essential to ensure rapid and effective response. Having a strong seasonal influenza program in place contributes to better preparedness and response for pandemics. Pandemic vaccines are useful tools for pandemic response and should be used in conjunction with other preventive and control measures like non-pharmaceutical control measures. And reviewing and updating the national deployment and vaccination plans for respiratory viruses of pandemic potential improves preparedness and ensures rapid and effective response. And with this point, I'm finishing, and over to Shoshana. She will be explaining about the national deployment and vaccination plan. So over to you. Thanks.
Thanks a lot, Chesko. And first, I really want to say thank you to all the team at PAHO for organizing this workshop and having us here. And also really to congratulate you, Chesko, for all the leadership in this area. Thank you so much, and congratulations for all the progress that is being achieved in the region on advancing the national deployment and vaccination plans. I'm going to start with a slide that has just a bit of text in there, but really to invite you to a bit of an exercise, on an introspective exercise. So imagine a new pathogen emerges tomorrow and that the vaccine is ready in 3 months. So we are now, 27th of May. So in August, we have to start vaccinating for pandemic influenza. How fast can we deliver this? Who is going to be targeted? Where are these vaccines going to go? How will you know that all the planning and the efforts and everything that you are going to implement at this speed is going to work? And why is the 3-month mark here? As Shoshana explained, there are these new platforms that are being developed, but even for seasonal influenza, there is a lot of gains that are being made in the production and the switching between the seasonal and the pandemic strain in terms of having these vaccines available. So we will be looking at shorter and shorter time frames. And the 3-month time frame is really something that might be very likely when we talk about pandemic influenza vaccines. In this time frame, you, as the persons responsible for planning in this area, will have to figure out how you're getting the vaccine, so both the strategic aspect, but also all the nitty-gritty, and you're going to have to do it in a pandemic, in a crisis situation, with very little information, I guess, at certain time points, because this will be emergent. So I guess where I'm going with this slide is that it's better to prepare for the things that we know and really focus on the unknowns at the time of the pandemic. And this is the spirit of having these national deployment and vaccination plans. There are many things we can plan for in advance, mindful of also of the lessons learned from the most recent pandemic, really strengthen the capacities and the capabilities that we know we'll need to have in place, so that at the time of the pandemic, we just activate these detailed operational plans. We retailor them for the pandemic that we are facing, but it will be much less work, and it will really be work that is geared towards the particularities of that particular virus and that situation that we will be facing, rather than having to plan for everything in a very short time span. So why develop an NDVP now? It's kind of what I mentioned just now. But another opportunity is that we also have the COVID-19 NDVPs. Most countries developed them. So it's really easy and a less of a lift to look at these plans, test them, adjust them, and retailor them so they are more generic. They are applicable to a pandemic influenza and to other respiratory viruses. Furthermore, the NDVP development is also an opportunity to maintain attention on pandemic preparedness and to really try to mobilize some resources in building some of those essential capacities, like maintaining the cold chain, all the investments that have been done as part of the COVID-19 pandemic, to give one example. Jessica already mentioned some aspects of it, so I will not go through all of them. But while we all recognize seasonal influenza is absolutely the best way to plan in a way for a pandemic influenza vaccine introduction, there are several other things that will come into play during a pandemic that makes the pandemic vaccination effort a bit difficult from a programmatic seasonal influenza one. So what are the things that complicate deploying, introducing a pandemic vaccine? The fact that health systems are under strain. So all the things that are normally in place and going smoothly, they will not be the same during a pandemic. We know that. Some of the routine vaccination programs are limited. I think the region, PAHO, is very fortunate, the fact that there are many countries that have seasonal influenza in place. And one of the great benefits, as also Shoshana explained, is that this is an adult vaccination type of vaccine that is being administered. But most of the countries outside the region, I guess, and not in certain regions, they have routine vaccination programs that are really focusing on pediatric population. So that experience of vaccinating adult population is not that prevalent. We already discussed the accelerated vaccine development timeline, which introduces a lot of complexity. But also during the response itself, we might be looking of having to change the vaccines because of the adaptations, new variants that may appear. So it's a type of flexibility that needs to be embedded into these plans and into the thinking and into the way the teams are being organized, into the way the data is being collected, analyzed, and acted upon. There will be fluctuating vaccine supply and demand. Those target groups that Cesco mentioned, they will evolve over the pandemic, also based on this supply and demand dynamic, not only the epi considerations. The multiple pandemic vaccines, Jessica mentioned them. There will be innovative vaccine components. We saw the experience with the mRNA ones, how this can really impact the demand and the way the population might be willing to vaccinate or refuse vaccination. The data collection, analysis, and sharing is going to be different compared to the seasonal one. Trust issues related to vaccine and in general, the pandemic environment that we saw fuels a lot of conspiracy theories and fears. And of course, the funding planning. There will be a lot of urgent demands, not just to introduce the vaccine as in a first go, let's say, but to really sustain that effort. We have seen that also the demand in vaccine often decreases because there is no constant investment in maintaining a steady vaccination campaign. So it's very important to understand these particularities as we go through the planning process. I think many of you might be familiar with the guideline that WHO has put out during the COVID pandemic, which referred to how to develop a national deployment and vaccination plan for COVID-19 vaccines. This was a guideline we produced building on the experience from 2009 pandemic, where a similar guidance documents was collated for deployment and vaccination plans for pandemic influenza vaccines. And now, after looking at this body of evidence and best practices and lessons learned, but also mindful of the PRED approach that really goes to the systems that need to be in place to respond to a pandemic, we have produced a new guidance that pairs the pathogen specificities with the system considerations. So now it really is something that can be very easily tailored for any pathogen of respiratory impact, but also these kind of plans can be redesigned for emergency vaccination in general. And I know certain countries in your sub-regions in the Caribbean might need emergency vaccination for certain communicable diseases, let's call them. So this is again a tool that can be really rapidly changed and pivot towards other type of emergency vaccinations as well. The current guideline points to 16 chapters that really go along all the things that need to be in place and thought through to ensure access, allocation, and deployment, introduction, delivery, and monitoring of the vaccination campaign. I will not go through all of them, but I just want to highlight certain aspects that are important, in particular, a chapter that talks about public health goals and related objectives, and also the legal framework that needs to be in place. As Josko explains, we have different public health goals that need to steer the vaccination response. Of course, these need to also be cushioned into the wider pandemic goals that will need to be achieved in different phases of the pandemic. And for this, we want to pair the vaccines, the antivirals, and the public health and social measures. So when you read the guidance and you look at this chapter, think through what the country can achieve with the vaccines, but also with the other tools that might be available. And this will allow for a wider protection of the population and a judicious use of the resources that are available. On the legal framework, I want to stress this chapter because really putting in place laws and reviewing these kind of frameworks takes time. This is really a preparedness activity that we advise countries to engage in now in the inter-pandemic period. And it would be a wasted opportunity if we don't look back on the COVID-19 experiences and try to put some things for public debate, or depending on how the country is adopting and reviewing legislation, so that these things are really thought through and introduced in a manner that increases trust in the authorities. I'm saying this because many countries were forced, I guess, because of the pandemic, to introduce orders. There weren't debates in advance on how certain approaches might be taken during the pandemic. And this, although they were done with the best intentions, they have led to debates and discussions. So it's really important that these things are thought through in the inter-pandemic period. So what we are doing across all countries and regions, and we have done this in PAHO as well, is that we offer countries the opportunity to develop and update these plans by engaging in national and regional workshops. And I think the approach that we are taking in PAHO gears at this point more on the national workshops that go also through a simulation exercise. And we are using an innovative way of doing this by using a tabletop game that really makes things very interactive. So I won't play the video now, but I think the slides will be shared. And we invite you to look at how this was carried out in Bolivia, for example, and hope that you will be curious and want to do this in your country as well. The intent is to have a very thorough review of what is already in place using the COVID-19 plans, go through a simulation exercise that goes beyond just exchanging best practices, but thinking through how you might react to different scenarios, and then really making a plan to update the existing COVID-19 plan and turn it into a more generic NDVP for pandemic influenza vaccination and other type of vaccine. I'm going to very quickly mention two other documents that are in development, and my apologies to the colleagues. I think I took too long for this presentation. We are working on two others, sort of guidance documentation that we soon hope to publish. One is on how to engage in national stockpiling. So it's a decision-making framework for a country to assess whether they would like to stockpile pandemic influenza medical countermeasures or use other type of mechanism. And another one is to look at the kind of criteria and considerations on how allocations of these pandemic influenza medical countermeasures or beyond vaccines might be done during a pandemic. So really going to the ethical considerations as well, in addition to potential epi considerations. And we also developed an analysis tool, which is a sort of Excel type of format that really quickly allows you to diagnose what kind of capacities and capabilities are in place and what are the areas that need to be strengthened at the national level to be ready for introducing these type of public health countermeasures. So I will stop here and hand over to Murillo and Jose Luis.
Thank you all. Thank you, Yana. We'll be speaking the next slide, please. Just a little about some important issues regarding lessons learned and also what's going on in terms of the new pandemic agreement that has been just approved in the World Health Assembly recently, and that has specifically an article dedicated to regulatory issues, because that was found to be so important during the last pandemic and to be taken into consideration for potential future pandemics. And we have there, it's a pity that it's a little teeny, the letter, but we have there key topics like the role of expedited regulatory review, which has been, we'll be commenting that in a following slide, is the need to strengthen the frameworks and to build technical capacity to be ready for adapting to pandemic conditions where we don't need and we are not able to follow the regular procedures for introduction of vaccines and medical products. And so we have to be ready to have the regulatory conditions to be able to weigh the safety and the need of the product and the efficacy according to regulatory procedures for emergency situations where we don't have the same patterns as for regular situations. And this new pandemic agreement that should be ratified by country is providing some lines for countries on this matter. We also have the pandemic agreement dealing with vigilance, the importance of vigilance for new products, particularly when we have products that don't have enough safety profiles finished or completed, and we need to have an intensive follow-up of the products. Chesko already mentioned that when they are introduced to the market. And so we have to have in place some mechanisms for implementing these specific measures regarding vigilance, intensive vigilance, or even active vigilance. And also have the capacity to connect and to coordinate with other countries, because during the pandemic, we have a lesson learned that will be mentioned in a minute about COVID. The following, please. We also have during the pandemic and in pandemic situations, we have the opportunity because of the limited resources, the limited offer of products for dealing with the pandemic, we have an opportunity for those wanting to introduce falsified medical products or substandard medical products, and that was the situation during the COVID pandemic. And it's also recognized and addressed by the new pandemic agreement that systems for following up and to be able to prevent, to detect, prevent, and respond to substandard and falsified medical products should be in place and well developed. And for that is key the collaboration between countries at the region and also with WHO. WHO has a powerful system for the vigilance and monitoring of the substandard and falsified medical products. And we have in place in the region a regional network of focal points for the prevention, detection, and response to substandard and falsified medical products. So it's important to get that in mind to be able to have this collaboration and to avoid, I don't know, spending energy in initiatives that at the end don't pay. So, and lastly, in the area to summarize this component of the 8th article of the pandemic agreement, we have the importance highlighted for public information and use of guidelines in terms of the importance of transparency in sharing the information. We for example, when we have safety events or safety concerns, we don't need to keep this within the country. It's important to share this information to promote the joint action and to be able to respond to that safety concern jointly, because that would be better than having a kind of not being open to other countries and trying to keep this within the country for being afraid perhaps of being exposed. But this is not the matter. The matter is trying to resolve jointly and quickly any safety concerns. And that is a matter of transparency and also of guidance in terms of what we should communicate, what should be taken into account for risk management and risk control and risk minimization. That's just an example. Next, please. And we had some lessons learned from COVID. Again, we have here what the new pandemic agreement is mentioning about expedited regulatory pathways. That was so important during the last COVID pandemic. Having countries being able to implement reliance or even the mechanism, we will be coming in the next slide with that, allow countries to have vaccines in a more expedited way. That's obviously through the regular mechanism. Enhanced communication, this topic has to do with the fourth importance of global collaboration. We have been able during COVID to establish a day-to-day communication with countries of the region in regulatory matters to hold not only webinars, but also an active and dynamic network for communication in regulatory matters. We have the network of focal points for pharmacovigilance, for example, where a lot of experiences were shared, and that highlights the importance of having this coordination and communication at the regional and global level. There is a key importance in the adaptation to product changes and also to be able to respond to challenges in regulatory processes. And that is not a matter of being able at the moment of the pandemic, but being preparing that before the pandemic or during the interpandemic periods like now. For example, it was so important that Chile reacted to the problems, the safety concerns. What happens when we have safety concern with a product that is of limited availability and we have a new safety concern arising and a country takes the lead in evaluating that situation, evaluating the risk and the benefits, and being able to produce a guideline on what should be restricted, not forbidding the product, not limiting the product to all the population, but just focusing on some population. That was Chile, what Chile did during the pandemic in terms of the use of the AstraZeneca vaccine when the safety concerns on thrombosis and thrombocytopenic issues arose. So that requires a quick mechanism for responding either to regulatory, if we have a production of a vaccine that seems to be good, but is coming from a manufacturer that in a country that we don't trust a lot, or being able to respond to safety concerns like I mentioned. And in the last topic, equity gaps in vaccine access, of course, we all know that that was a thing that is now being addressed in the new pandemic agreement, and that countries should be ratifying for greater collaboration and ensuring that there is not such big gap as it happened in the last pandemic. The next one, please. And coming again to regulatory pathways for vaccine introduction, we have different mechanisms, and we have, of course, the full review with the Common Technical Document Dossier, which is the way any product enters for registration. And this is the standard products for new application, but this is not the regular way or pathway during a pandemic. We have emergency use authorization that has different applications in different countries, or different even definitions in different countries. But this is a tool for providing quick access and allowing to expedite availability of vaccines if we put the conditions that emergency use authorization has, like the follow-up of the safety concerns or the risks or specific safety issues that this product may have. This is a condition of the emergency use authorization. And we have also a reliance. PAHO has a lot of guidelines on reliance on mature authorities that enable us to rely in very mature authorities, and so to be able to adapt or adopt these regulations and be able to make quick assessment and quick authorization of medical products if we rely on the decisions of other authorities. And this doesn't imply a resignation of sovereignty. This is a matter that the country with this sovereignty evaluates that there is another regulatory authority that has things in place important and evolution so as to adapt them. And we have, of course, the recognition of WHO decisions and WHO collaborative registration, which is a matter of relationship with the pre-qualification products, where WHO makes an advanced evaluation, and so allow countries to rely also on their decisions. We have also the issue of vaccine strain change procedure, which requires also being prepared for quick adaptations in regulation. And finally, the regional technical cooperation mechanism of the PAHO revolving funds that have special mechanisms for introduction of medical products and specifically vaccines in countries. Most of the countries in the region have signed agreements for letting these products come under exceptional mechanisms, and so more expedited mechanisms, and that should be taken into account as part of the list of mechanisms for accelerating introduction of medical products and specifically vaccines. And now I lay the floor to my colleague Marilia to finish this presentation. Thanks.
Thank you very much, Jose Luis Castro. And colleagues, it's a pleasure to be with you today. The idea, of course, as we are seeing this whole presentation, to be prepared for the next pandemic, we must strengthen our capacities, right? And therefore, we want to highlight some critical aspects, continue to highlighting these critical aspects. And as you can see here, we have three main aspects that we can cover regarding to the situation that we are preparing. First of all, we need to talk about import procedures. We know each country has their own important procedure, but normally it's very important to highlight that to ensure efficient import process during the vaccine access moment, and regularly review your importation process, because we need to avoid any bottlenecks to have a expedite process to nationalize the product when they arrived. Even during the importing process, we can use that to track the products on the market. So we need to have every information since the beginning. But it's very important to highlight that there is a cost to import or to nationalize a product, mainly if we're having some situation regarding to your clearance process, right? During the customs situations that you need to have a documentation verification, inspections, the tax, and pending clearance. That's very important because those products are cold chain maintenance, and you should have everything in a place that you can maintain this product there in not so much time to release this product. So, and then there are many documents that should be reviewed during this moment regarding to manufacturing protocols, certificates of analysis, packaging leads, and so on. That's all information should be arrived and see the authorities release together with these documents. WHO recommendations also recommend for the permits or importation within 5 working days only maximum, and that's where a recommendation, because more than that could have a more timing process to release these products, not good for access these products. Enable, of course, the manufacturer to import or even export. It's very important aspect to be covered during this revision of your legislation. Lot release and traceability, it's another very, very important situation, because many countries normally today depends from the capacity. They want to release the vaccines based on lab testing. But here we are recommending that to do the rapid assess of the revision of documentation and release this product in until 2 days, because more than that also will impact the access of the products. These we can call that lot release based on summary product reviews, not based on lab. Then it's important to maintain the national records for that vaccines for distribution, for traceability. It's very important to have that to prevent counterfeit medicines or products on the market, recall efficiency, inventory management, so on. And also, we recommend to have products using the 2D barcodes. That's the normal barcode that is very important to this packaging traceability in the country. And then the legal framework. We have a legal framework right now in all countries normally, but the revision for this moment, this inter-pandemic period, it's very important, and to consider to update for many situations, and different situations like donations, even investigational use, not the normal registered product. And then it's to be prepared for situations like even compensatory mechanisms for adverse events, and a no fault compensation framework. and we can tell you, next please. So this is a publication that we know about it. It's very important to mention that there are very important recommendations there to enable this moment to have a revision from your framework for rapid exchange information among other countries and reduce duplication efforts during your assessments and ensure transparency during all process. Next, please. And let's go into the end to our presentation because this is a highlight only presentation for you, mainly based on these important resources for you. Because if you are having your mapping today to see your strength and your gaps, you can conduct what is the best in the future and try to keep move to strengthen your capacity building based on high priority needs, and then to medium and long-term objectives. And using the WHO global benchmarking tool, for instance, you can have your regulatory system accessed based on more than 260 indicators. Then you can find specifically where you can focus on to strengthen your system, but mainly based on authorization, surveillance, and pharmacovigilance that are the main functions that we are recommended to do right now. And then two goals to strengthen your maturity level, build the confidence, support reliance mechanisms, and then, of course, in the end, to have your decision-making process mapping and having everything in place to receive your products when you need it. Thank you very much. Here we are. If you need any questions, we are happy to be to answer your questions or any any comments that you want to do. Thank you very much.
Thank you very much to all of our presenters this morning. I noted that we did not receive any questions in the Q&A, but I would like to stress that the floor is still open beyond today's session. The team remains available to support all of the country's efforts in updating their national pandemic preparedness and response plans. So if you feel like after today's session or in the coming weeks, you have any questions or concerns, please feel free to reach out to us and we will guide you as best as possible. I would like to mention here that now that we're wrapping up this series of webinars, I will send a link to all of the registered participants, and you will find a folder that has all of the presentations from different sessions, the recordings, and any of the documents that our speakers may have referred to for you to have, the relevant guidance moving forward. So look out for that. I would like to end by thanking again our speakers today. I felt like it was definitely very rich and insightful, especially for myself. So I could only imagine how, happy our participants would have been to receive this information. We are truly grateful for you spending this time with us. And touching, as you mentioned, it really was a bit of a summary presentation given the time, but touching on those key points for the different countries to start focusing on. I feel like moving forward and updating these national pandemic preparedness and response plans, I would encourage the different country focal points or participants today to really integrate the tools or the guidance that would have been shared today, especially that emphasis on the seasonal influenza programs as a platform for pandemic response and the importance of developing or in some cases refining those national deployment and vaccination plans. So again, everyone, thank you for spending this hour with us. Do look out for that follow-up email for you to have access to the information that you need and key contacts again for you to pose any questions or concerns or get clarification, whether it's on wording or strategies as you update these plans. So thank you again for joining us over the past few weeks, and I hope you do enjoy the rest of your day. Bye.